I work here. This is where I work, in Maui. I just moved down in May from Oahu. This is a great hospital. I have plenty of patients here. This last week, I was taking care of my patients. I have plenty, like I said, all of them but one had a condition that they were in the hospital for that could have been prevented or reversed with lifestyle change. Think about that, all but one. It's unreal, right? So I'm a surgeon. I love to cut, right? They say a chance to cut is a chance to cure. Is it though? Is it really? That's the question you have to ask yourself. Has anybody heard of a surgery without any risks? Has anybody heard of a surgery without any complications? Okay. The day I became a doctor, I got my MD degree, I took an oath. It's called the Hippocratic Oath. One of the biggest things in the Hippocratic Oath is first do no harm, right? So for me, that's where the rubber meets the road, right? I think about that. I think about that every day. Are my patients that are under my care, they're there for a preventable thing? Well, why am I not going upstream? Why am I not attacking this before they develop these chronic diseases and come see me? So that's the impetus for the talk. I hope you guys learned something. I hope you don't develop chronic disease, and I hope you never meet me in the hospital. So let's start. This is the most recent data we have from the CDC, leading causes of death from 2016. Anybody know what the #1 cause of death is in the United States?
Heart disease.
You guys are good. Okay. How about the second?
Cancer.
Cancer. And they're almost tied now. You can see cancer's increasing. Heart disease is about stable. How about #3? This is a new one this last year. Accidents. And most frequently, accidents are a result of accidental poisoning, which are a result of overdose from opioids, narcotics, etc. This is an important issue. And then we have the rest of the stuff, right? We have stroke, we have Alzheimer's disease, many, many other things that can kill you. But what I want to show you from this slide, 80% of everything, every leading cause of death is potentially preventable or reversed with lifestyle changes, with the choices you make. So let's take a step back to the past, 1900. What do you think the leading causes of death were back then? Infections, right? Fevers, that type of stuff. Heart disease, yeah, it was there, but not so much. And then you take a look at 2010. Whoa, heart disease, cancer, right? Big changes. If you were born in 1900, your life expectancy, pretty short. If you're a man, you'd live 48 years. A woman, 51 years. We've made accelerating changes in the field of medicine, right? We're living longer, that's for sure. Today, we can live 76 years if you're a male, over 80 if you're a female. That's wonderful. But there's still a lot we have to take into account. I put this in just because I think it's a fun slide. This is from Boston, 1811, causes of death. And if you look at it, they counted 942 people died. They died of all sorts of stuff. But check it out, cancer only killed 5. Cancer only killed 5 of all of those people. And then they had other stuff I actually had to look up, like what is dropsy? Dropsy apparently killed 21 people. It's edema, by the way. So let's look at life expectancy. This, for me, is a scary, scary graph. What we're seeing, life expectancy going up, 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 and all of a sudden it's leveling, even going down. Experts are predicting this is the first time ever in human history that we are going to outlive our children. Not a good thing. So how can we fix it? How can we prevent it? Well, this is borrowed from David Katz, one of my colleagues. Forks, feet, and fingers. What do I mean by that? Well, it's the decisions we make. What we use our forks for. What we use our feet for. Are we active? Are we exercising? And then the last one is fingers. We cannot forget, still in the world today, the #1 cause of all deaths is tobacco use. So are we smoking? Are we not? So So body mass index, what do you think changed from 1900 to today as far as our body mass index? We're getting bigger, right? As a whole, people are getting bigger. And you can see right now, 2 out of 3 Westerners are obese or overweight. And the numbers are getting worse. You can see another picture in this graph here. The numbers are worsening. We are all getting more obese and more overweight. Do we really care about that? Do we care if we're overweight? We absolutely do. Because when you're overweight, it leads to chronic inflammation, and inflammation leads to a lot of these diseases we're talking about. So I have patients ask me, what if there was a magic pill? What if there was something I could just take every day and I would never get any of these diseases? I'd be healthy, I'd be active, I'd be happy, I'd be vibrant. What if I just had one pill? People would kill for this pill. People would buy stock in this pill, right? Well, the answer is the pill, it's kind of there, but it's not a pill. It's a whole food plant-based diet. And we'll talk about why. I have a couple disclaimers I want to make really quick because I do think they're really important. First one, it's not a junk food vegan diet. Oreos are vegan. Are they healthy? Oreos? How about French fries? Not healthy, right? So we're talking about healthy food, unprocessed food, whole food. And then the second disclaimer is exercise and social group support are huge. We're getting so much new research now showing that the group support is one of the biggest things that can make you healthier in the long run. This is brand new, the Quadrants of Health. Has anybody heard of the Quadrants of Health? So essentially, the Quadrants of Health are 4 tenets for a healthy life. First one is healthy eating, arguably the biggest one, right? That's the most important one, and the cornerstone is healthy eating. Second one, physical activity. Third one is healthy weight. And fourth one, ooh, this one's interesting. How do you measure this? Emotional resilience. What is emotional resilience? That's how we act in times of adversity. How do we respond when something challenging happens in our life? Very important. So how many Americans do you think are compliant with any of those 4 things these days? Yeah, so it's kind of small, I know, but the red are people that are not compliant. So healthy eating, 77% of Americans are not eating healthy. 60% are not being active. And then you have 60% are at an unhealthy weight. And emotional resilience for 50-50. So it's the best out of the group. So this talk today, it's about healthy eating. But in order to talk about healthy eating, we actually have to first talk about unhealthy eating. So let's take a quick minute to talk about it. What's the standard American diet? You guys heard that term before? Anybody? Yeah, so standard American diet. What characterizes a standard American diet? Good. You guys are star students. So highly processed foods, right? Anything that's processed. And then we're looking at the 3 characteristics of the standard American diet. High fat, high sugar, high salt. All these things contribute to chronic disease. I had to put this slide in here because the very first Veg Fest we had here, I gave a presentation like this, and unfortunately, I showed some graphic material, and we had one gentleman pass out. So I got to a point in my talk, and all of a sudden I hear, we need a doctor. And I had to stop the talk, go back and help this poor gentleman. And he passed out because it was gross, what I was showing. So I have to tell you guys, I'm showing some gross stuff. Are you okay with that? And I'll try to warn you before we get to it, but I'm going to show you some guts. I'm going to show you autopsy organs. I'm going to even show a video clip of open heart surgery. So please, I'll warn you, but look away. Look away if you don't want to see it, okay? No more helping passed out people. All right. So we'll start with this one, 10 ways. Number 10. I gotta start with the number 1 pillar, atherosclerosis or heart disease. Super preventable. So like we talked about, it's the leading cause of death in the US and worldwide. Can you guys hear me okay? Okay, just making sure, it's getting kind of noisy. But heart disease is a direct result of inflammation, cellular stress, and cholesterol and plaque buildup. So when you look at the progression of heart disease, it starts out with something pretty benign. It's called a fatty streak. And then it progresses to endothelial dysfunction, which is inflammation, and then progresses to plaque. So here's an autopsy, aorta, growth. When you look at that, see that little white thing the arrow's pointing at? That's called a fatty streak. That's the first sign of heart disease. How old do you think this patient is?
23.
Man, you guys are so good. 10.
Wow.
We start getting the first signs of heart disease when we are 10. That means everybody in this room with a couple little ones, we're worried about the heart disease when they already start forming, right? It's not about what we're gonna get, it's about what we already have. So how can we prevent this getting worse? So when we look at a cross section, so like an artery cut in half, any artery, whether it's the artery that feeds your heart, feeds your brain, etc., you can see this whole little layer on the underside there. That's inflammation, inflammatory cells, and plaque. And plaque builds up and it causes narrowing of the arteries. But even worse, if this artery, that plaque ruptures, then you have a little piece of a solid something that's traveling downstream and can cause blockages. If it's in your heart, you get a heart attack. It blocks the part of your heart. If it's in your brain, it can be a stroke. If it's in your legs, you can lose the blood flow to your legs. So this disease is not only heart disease, this is all over the entire body. Another gross picture, sorry, autopsy heart. You can see here, this patient died of a heart attack. The LAD is a blood vessel in the heart, and we nickname it the widowmaker. We nickname it the widowmaker because that is the one blood vessel that if it gets clogged, artery is clogged, that causes death because the heart oftentimes will lose its blood supply. And you can see the other part, the area of infarct. Oh, I wonder how we fix that.
There it is.
Okay, so you can see on the bottom how it's dark, really dark. You can see obviously this heart has lost its blood supply. Anybody heard of an angiogram? So if you have symptoms, if you have chest pain, we recommend an angiogram, where you go to the angiogram suite and they actually put a catheter in your vessels, in your groin, and they thread it all the way up and they take a look at your heart. They shoot dye in the arteries in your heart. And they take a look to see if you have any blockages. And you can see here, this is a picture of a blockage. See that arrow? That's a blockage up high. This is a very bad angiogram. Video coming right up. Please look away if you don't want to see gross. Oftentimes we fix this with open heart surgery. We crack open the chest, we bypass these blood vessels, and we actually sew brand new blood vessels to create new blood flow. It works pretty good, right? It's a good surgery. It saves lives, there's no doubt about it. But it costs over $150,000. And then on top of that, the grafts can fail. 15 to 30% of them actually block after 1 year. So think of how extreme that is, going through all that and then having a blockage. So you're left with a big scar. There must be a better way, right? There must be a better way. These unfortunate people are caught way downstream. They've been dealing with this disease for quite some time. Well, there is a better way. There's a way to reverse heart disease, believe it or not. This guy, Dean Ornish, anybody heard of Dean Ornish? Okay, wonderful. So he did a lifestyle trial. He took 48 adults. They were very, very sick adults, really severe heart disease. There's a saying in surgery, if somebody is not a good surgical candidate because they're so sick, we say they're not even fit for a haircut. These guys were not fit for a haircut, okay? He took these patients and he did intensive lifestyle change. What is intensive lifestyle change? Well, 4 pillars. Certainly looks a lot like those 4 quadrants of health that I had shown you earlier, right? First one is diet, whole food, plant-based diet. 2, moderate activity. 3 is going to be stress management. And 4 is support groups. These are all key pillars of the Ornish program. Diet specifically, you're looking at a very low-fat diet, 10%. It's very low. 82% of all of his patients, their heart disease was reversed. It regressed, it got better after a year. 82% success rate on these poor candidates, right? So when you look at it in graph form, Dr. Ornish followed these people out even 5 years after his intervention, and he found that the opening of all these blockages kept getting better throughout time, okay? That's wonderful. And then this graph on the right here shows that the people that were the most adherent, meaning they stuck to the plan, they had much better outcomes, even compared to the ones who were kind of adherent. So the moral of the story is you can't kind of go halfway, you gotta do it all. Anybody know this guy? Yeah, so this gentleman, I had the pleasure of speaking for him at Plantstock last year. He's wonderful, Dr. Esselstyn. He wrote an article a couple years ago called A Way to Reverse Coronary Artery Disease. This was published in Journal of Family Practice, huge mainstream journal for all family practice doctors. He did some research many, many years ago also on heart disease. Here we've got a PET scan of a heart. You can see on the top. A PET scan, when you have good working muscle, lights up. So on the top, you can see there's an area that's dead. There's no color there on that heart. And when you look down after the treatment, whoa, that muscle woke up. That's kind of cool. How long do you think these people were on this diet? Just 3 weeks. All it took was 3 weeks. And then you remember those angiogram pictures. The one on the left, this is the same patient. We did an angiogram with a vessel completely narrowed, and after the intervention, vessel completely opened up. It's magical stuff, right? It's like that magic pill. So that's heart disease. Let's move on to number 9. Anybody have a guess on what 9 is? That's coming. Cancer, right? So the second killer. We're going to talk about breast and prostate cancer together because they're the most common cancers in men and women. So if you look at estimated cancer cases for 2018, number 1 in women is breast, number 1 in men is prostate. And then number 3 we're going to talk about too is colon and rectum. So there is an organization called the AICR, American Institute for Cancer Research. They teamed up with the World Cancer Research Fund, and they studied a whole bunch of people, and they came up with a list of recommendations for preventing cancer. These are great recommendations, but what really struck me when I read them is the following. Diet can reduce incidence of cancers by approximately 1/3, and another third can be prevented by abolishing smoking. Think about that. You quit smoking and you monitor your diet. 2/3 of all cancer can be prevented. That's huge. So let's go through these 10, since they're so important. First one, and I'm sorry, it's a small screen. First one, be as lean as possible without being underweight. You want to be kind of right in the middle, be as lean as possible. Number 2, be physically active. So activity again, here it is, for at least 30 minutes every day. Limit sedentary habits. They say sitting's the new smoking. So by the way, if any of you want to stand up during this presentation, please do. By all means, get up, do some jumping jacks, I don't care. Pretty informal. Number 3, avoid sugary drinks. You want to limit your consumption of energy-rich foods. So sugary drinks, you think about it. Coke, Diet Coke, whatever soft drink of choice, there's so much sugar in there. And if it's not sugar, it's high fructose corn syrup. It's even worse. Number 4, eat more of a variety of vegetables, fruits, whole grains, and legumes. So diet again, eat fruits and vegetables, right? 5, limit consumption of red meat, especially processed meat. Number 6, if consumed at all, limit alcoholic drinks to 2 for men and 1 for a woman daily. Number 7, limit consumption of salty foods and foods processed with salt. So again, standard American diet, salty, right? So try to limit that. Next one, 8, it's an important one too, and that's don't use supplements to protect against cancer. They did some studies on a few supplements. Anybody remember vitamin E? For a while they were saying it was great in preventing all sorts of awesome, it was like a magic pill. And then they found out when they did the studies that no, it actually increased your risk of many things. So try to stay away from those if you can. Number 9, If you are a mother, it's best if you can breastfeed exclusively for up to 6 months. And then you can add in other liquids. And then 10, this one's super important. After your treatment, if you are a cancer survivor, stick to the above stuff, because that's going to decrease the chance of other cancers happening or the cancer you have coming back. Make sense? So how valid are these? Are these good markers? Well, I'll show you some data in a minute. So the cancer in the meat, the red meat, this is not a new concept. This article was in the New York Times in 1907. They started noticing already, just epidemiologists noticing, there was increased cancer among meat eaters. So let's talk about breast cancer. Most common cancer in women. The majority are hormone dependent, meaning these cancers feed on estrogen or progesterone, right? Obesity harbors estrogen. A lot of the fat cells that we have when we are aging women produce estrogen, and it can consequentially feed cancers. I'm going to bring up one thing. October, right? It's October. It's Breast Cancer Awareness Month. Maybe instead of buying that pink hoodie or, I don't know, the pink water bottle or wristband, maybe we can really work on educating people and working ourselves to just having a healthier lifestyle and a healthier diet, preventing it in the first place. So these studies, reducing the risk of breast cancer, nutritional strategies. These are all studies that looked at those 10 guidelines I just told you about and how well do they prevent cancer, breast cancer in particular. Here's another one. And essentially they're saying yes, every requirement that you meet decreases your risk of breast cancer significantly. So there is good data, multiple papers behind those 10 key points. I'm going to take a minute to talk about survivorship. 1 in 8 women is diagnosed with breast cancer. That means there's a lot of women out there that have had breast cancer and they are surviving. They've gone through the treatment, but many times they live in fear that this cancer is going to come back. Well, we have good data showing we can prevent that. 4 things, right? Physical activity, diet, fruits and vegetables, managing obesity. So let's talk about physical activity. When we talk about activity, especially in the setting of cancer recurrence, it needs to be vigorous. How do you judge vigorous activity? Anybody know? Your heart rate's a good way to do it. Your breathing. The best way is, can you talk? Are you exercising so much that you can still have a good conversation with your girlfriend? Or are you exercising to the point where you're huffing and puffing and you can't say anything? If you can't converse, that's good exercise. That's vigorous exercise. Make sense? Okay. So if you do that, if you do the physical activity, we know you have a 41% chance of dying from anything in these breast cancer women. 34% decrease in dying from your breast cancer means your breast cancer is not coming back, and a 24% chance of your breast cancer coming back. Make sense? So they're good guidelines. I had to bring it home to Hawaii. UH here is doing a study on hula and breast cancer survivorship. It's now close to enrollment, but we're waiting on publications regarding this, and I believe the results are going to be pretty staggering. So we'll keep tuned for those. As far as diet, we know that a high fiber diet decreases the chance of your breast cancer coming back. Why is that? Well, fiber is going to inhibit the absorption of estrogen. Remember, estrogen feeds a lot of these breast cancers. And you got to eat at least 5 servings a day of fruits and vegetables. So here's the graph. Here's where the picture means everything. That little blue line on the top, that's a survivorship curve. So these women with breast cancer, if you have high fruit and vegetable intake, high physical activity, your chance of surviving breast cancer is super, super high. All the other curves are various combinations of low fruits, vegetables, low physical activity, etc. And one thing I found super interesting, all of this stuff, high fruits and vegetables, high physical activity, it changed your survivorship regardless of obesity. Whether you were large or not, you still had the same survival rate. So you have a 50% decrease in death with high fruit, and it's independent of obesity. So fruits and vegetables where it's at. Let's take a quick minute to talk about prostate cancer. With prostate cancer, I recommend to refer to the data on breast cancer. And the reason why is because prostate cancer is also a hormonally driven cancer. They are both hormonally driven. Dean Ornish again, I think he got bored with the heart disease stuff, so he moved on to prostate cancer. And he took a look at some men who had prostate cancer, but it wasn't high risk and they could be monitored medically. He took these men and he measured the activity of their prostate cancer cells. And what he found is basically that if you are on the Ornish program, the diet, the lifestyle, etc., your chance of those cancers progressing super, super low. All right. So some quick data-driven strategies to prevent prostate cancer. This is adapted from Joel Furman. And I kind of feel like a broken record, repeating myself over and over again, because it's the same stuff. So eat a whole food, plant-based diet. Get your folic acid from food, not from supplements if you can. Avoid fried food. Exercise, right? Exercise up to 6. So those are the cancers. Let's talk about 8. Colon cancer, right? So colon cancer, anybody ever had a colonoscopy? It's an interesting experience, right? You get sedated and they look up in your colon and they look for polyps, they look for cancers. Well, here's a picture of a cancer, just so you have an idea kind of what they look like. They're the 3rd most common cancer in all Americans. Risk factors, so sedentary lifestyle is one of the biggest. We know dietary factors can increase your cancer risk. So a low fiber diet increases cancer risk, colon cancer risk. A diet high in red meat directly linked to colon cancer. We'll talk about that in a minute. Diet high in processed foods, same thing. Processed foods tend to be low in fiber. So it's all interrelated. And then if you have a diet where you eat low fruits, low vegetables, and legumes, also increases those. So lifestyle modifications, same exact thing. Same data that we are seeing with the AICR studies, those 10 points that I showed you earlier. If you adhere to those 10 points, you're going to have a lower rate of colon cancer. I think I have, let's see. Yeah. So let's talk about red meat for a minute. Why does red meat increase your risk of colon cancer? There's a few factors, and one of them is if you have meat, you're usually cooking it at a high temperature. You're grilling it, or you're searing it, or frying it, or something along those lines. You actually can get heterocyclic amines. These are pretty toxic. You can get something else called advanced glycation end products. Anybody heard of those? Aged advanced glycation end products? These things wreak havoc. They cause oxidation, they cause a lot of inflammation in your body. And this is a direct result from eating meat. And then there's N-nitroso compounds, and we'll talk about those. Anybody heard of TMAO? Yeah, so that's the best known nitroso compound. TMAO, it happens when you eat something that has carnitine in it. So eggs, red meat, have carnitine. When you swallow these, they get metabolized by an enzyme made by your gut bacteria into TMAO. TMAO can directly cause heart disease and can also cause colon cancer. It's an inflammatory molecule, and it's the most well-studied molecule we know of in that family. So we know fiber-rich foods do the opposite. The more fiber you eat, the lower your risk of colon cancer. The risk of colon cancer is reduced about 50%. So 50% is huge if you're on a high fiber diet. And the other thing is with fiber, you gotta eat a bunch of leafy green vegetables, a bunch of colorful vegetables. You get a lot of phytonutrients with that high fiber diet. And then lastly, I have to talk about alcohol and tobacco, because both of those are linked to colon cancer. So when you have alcohol, excessive alcohol, it gets metabolized into something called acetaldehyde. And acetaldehyde is a toxin, and it's an inflammatory molecule again that irritates the colon lining. The carcinogens with the tobacco I don't need to talk too much about because they're so well known as far as causing inflammation. So physical activity, again, physical activity, colon cancer are inversely related. So the more active you are, the lower your risk of colon cancer. Even 24% lower if you exercise. Questions on colon cancer? Okay. Number 7. Any guesses? Number 7? Obesity. So I gotta talk about obesity because it is important. And obesity is directly related to what we eat. So medical complications of obesity, there's a lot of them. And we'll go through a few of these. This is a CAT scan of one of my patients. She's a little obese. We had to talk about lifestyle and obesity, and she said, "But doc, you don't understand. I'm just big boned. I'm just a big boned person." And then we looked at the CT together, and she said, "You know what? Actually, I get it now. I have little bones. I'm a little person in a big body. And luckily, this is easily fixed." The thing for me is in surgery, the more obese you are, the harder it makes the surgery. It makes it really tough for me. This is a gallbladder surgery. And if you take a look, that gallbladder is that little round ball up in the left side of the screen. And all that yellow stuff is fat. And my job is to dig through that fat and try to get to the important structures so I can safely cut them and clip them. It's much more difficult the more obese you are and the more fat that you have to work through. The other thing I want you to see is this liver. The liver is that brownish thing kind of on the top. That's already starting to show some changes of fatty liver disease. Anybody heard of fatty liver disease? It's a big deal. There's a close-up. All those little yellow, kind of hard to see on that screen, but the little yellow specks there are fatty liver. And what happens is these fatty liver cells continue to worsen. You get something called fibrosis and scarring, and then you get something called cirrhosis. Cirrhosis is bad. Your liver does not function like it should. Experts are predicting by the year 2050, the leading cause of liver transplants will not be cirrhosis from alcoholism or hepatitis C. It will be fatty liver disease. That's scary. So, a lot of studies have been done on body mass index and complications. We know that the larger you are, the longer your operative time. The longer that you are under anesthesia, it's a higher risk to your heart, your lungs, for any complication from your surgery as well. Again, outcomes with laparoscopic surgery, same thing. The larger you are, the more difficult the surgery. But obesity is a hard one. It's a hard cycle to break. If you think about that, you have reduced self-esteem because you are large, and you may be very, very self-aware of that. And that may lead to emotional eating, and then you may have excessive weight gain, and then you have further reduced physical activity because it hurts to move when you're larger. And it's hard to control your appetite when you get to that stage as well. So how can we break that cycle? What can we do about that? Well, the beauty is the diet, what you eat, changes things. This graph here shows your body mass index on the up and down, and on the other side shows your diet. The vegans are on the right, their body mass index is the lowest. Pretty common sense. And then on the left you have the meat eaters, so everything in between. But we do know that vegans, as a population, are the least obese. You think it's not real? This is my friend Josh Rajani. He started out very obese, having health problems, addicted to pain pills. And a couple years later, he turned his life around. Diet, lifestyle, now runs regular races. I think that's a one-time, one-off case. No. This is my other friend, Tim Kaufman. He's a great guy. He's a high school teacher, actually. Lost weight, same thing. And one more. There's so many success stories out there on the internet. It's a real thing. Any Japanese readers? It's a saying, right? Hara hajibu. Probably massacring that pronunciation. But what it comes down to is the philosophy to eat until you're 80% full. So not to eat everything on your plate as your mother taught you when you were growing up. Just to stop when you're 80% full. It's such a beautiful philosophy and something I try to live every day. There's obesity. Questions? All right. Number 6. This one's all about fiber. Fiber is my little pet project. Only 1 in 6 Americans get enough fiber in their diet. We are a fiber deficient nation. So fiber is the broom that sweeps the colon clean. It's super, super important. It's super important for our gut health. It's important for making sure that we have the right chemicals that are metabolized from the food that we eat. And we know that fiber is good overall health, but also decreases our risk of hemorrhoids, certain cancers like we talked about, colon, breast, prostate, obesity, heart disease. There's all these links. And hyperglycemia, diabetes. So pretty much everybody can handle fiber. I'm going to take a minute to talk about hemorrhoids because I operate on them quite a bit. Over 3 million cases in the US every year. They are a scourge. My patients are miserable. And what it is, if you look at a cross-section of the anal canal, it's when the blood vessels around the rectum get enlarged and very tender. Sometimes they clot. Sometimes you have these large masses that come in and out of the rectum. It's no fun. What are the risk factors for hemorrhoids, you might ask? It's a low fiber diet. So increasing fiber can help with your digestive health and help decrease hemorrhoids. Diverticulitis is kind of the same story. You guys know what diverticulitis is? It's essentially an inflammation of your colon. And I'll show you a picture here. It's very small to see, but basically there's these little pouches that come out from your colon. We call them diverticulae. They can get inflamed. It causes quite a bit of pain in patients when they become inflamed, and oftentimes leads to surgery. This is an autopsied colon here, or a pathology specimen. You can see the pouches really well on that one. Little teeny pouches, and they can fill up with bacteria and get inflamed. And what happens is when they get inflamed, sometimes they can perforate or cause problems. And then they call me to do a surgery and remove that area of the colon. And oftentimes I have to create what's called a stoma or a colostomy, which is where these patients have their intestine brought out to their abdominal wall and their bowel movements go into a bag for a while rather than the normal way. It's a temporary thing. Oftentimes we can reverse it, but nobody wants that. And the beauty is that diverticulitis is directly linked to fiber. There's a group of people in England called the EPIC cohort. People did a whole bunch of studies on them, and we monitored everything from what they ate to did they get cancer, did they get heart disease, but we also looked at did they get diverticulitis. And we found that they're exactly inversely proportional, meaning the more fiber you eat, the less your risk of getting diverticulitis. We're on to number 5. There's the diabetes. So by a plant-based diet, you can have more consistent glucose levels. You can avoid diabetes and avoid the complications of diabetes. Diabetes is a very common thing, and there are a lot of complications from that, which are surgical. By 2050, they're predicting 40% of Americans are going to have diabetes. And then Black women and Hispanics, even up to 50%. It's a high number. What are risk factors for diabetes? There's a whole bunch of them, but everything except for height is a choice that we make, right? Smoking, alcohol intake, what we eat resulting in chronic diseases. Well, Neil Barnard and some other people did some very good research on plant-based diets and diabetes. And we know that the vegans have the lowest risk of diabetes. We know that. And we've also known that we can reverse diabetes and get people off of their medications with a healthy diet. So diabetes has these complications. 68% of them get heart disease, 40% nephropathy, which is a problem with your kidneys. We get diseases of the blood vessels in the lower extremities. And then we get wounds on the feet, ulceration, even amputations have to happen. This patient, I got his consent for this picture, but he ended up having a very bad diabetic infection of his toe, to the point where there may not have been any salvaging of the toe. This is when they come to me too late. Fortunately, this wonderful man I took care of for quite a while, and I saw him every week checking on his wounds in my office. We talked about food, we talked about lifestyle, and I'm happy to say he did reverse his diabetes with a whole food plant-based diet. It was wonderful. It's never too late is what I'm trying to say. So what we have here, hemoglobin A1C, are you familiar with that? It's a lab that we get that measures how well your diabetes is controlled. Lower is better. And you can see the solid line, not the gray line, the solid line are the vegan people, the whole food plant-based, and the ones above are just your regular diet. A healthy diet decreases your hemoglobin A1C, which is huge. So we're on to number 4. Gallstones, gallbladders, the most common surgery that we do in this country. Yeah, so that is an issue with compliance. So we know that a lot of times people, they see initially that they have success, but they don't want to stick with it. Some people think that it's very extreme to go on a whole food plant-based diet. So it brings the importance of the point that we have to have support groups and ongoing interventions to help people stay on track. Great question. Yeah. So gallstones, most common surgery I do is taking out gallbladders. 60% of the people have gallstones. Most of them don't cause symptoms, but sometimes they do cause symptoms. It's a gallbladder full of gallstones. What do you think most gallstones are made of? Cholesterol. You're absolutely right. So over 80% of all gallstones are cholesterol. And where do we find cholesterol? In animal products, right? In dairy, in meat, etc. Plants have no cholesterol. None. And I remember when I was in my surgical training, I read my textbook on gallbladders, the chapter on gallstone disease. And there was a sentence, I had to read it about 3 times to make sure I wasn't misreading it. It basically said, vegetarians have little to no gallstones. In my surgical textbook. So it's very real. We know that the risk of having gallstones goes way down if you don't eat meat. That was a quick one. We're on to number 3. Degenerative joint disease. A common need for surgery. People have arthritis when they age, inflammation in their joints, and oftentimes need joint replacements. But we do know diet and exercise, changing those, can decrease your risk of needing surgery and needing a joint replacement. Here's a paper showing a whole foods plant-based diet alleviates, gets rid of the symptoms of osteoarthritis. And another one, prescribing optimal nutrition and physical activity is the best practice management for osteoarthritis. So if we can catch it early and make changes, we potentially can eliminate the risk of people needing these unnecessary surgeries. Arthritis, though, is a tricky one. It's kind of like the obesity, this triangle, right? We're inactive, and we're inactive because it hurts to move because we have arthritis, but we know we have to move in order to improve our joint disease. So it's a really tough one. But we do know the one thing in common for all of this is inflammation. So if we can decrease that chronic low-grade inflammation in our bodies, we'll have better outcomes. Number 2. I like this one. It used to be not based on science, but we're learning so much. You can have more radiant skin, feel your best, have excellent self-esteem. So what about diet and acne? Do we know? Is there a link between what we eat and whether we have acne? There absolutely is. We know that avoiding dairy, even chocolates on there, which made me a little sad, can help decrease your acne. But not only that, remember how I talked about the advanced glycation end products? Those compounds that come when we're cooking meats and they're toxic for colon cancer? Well, advanced glycation end products also attack collagen, which happens to be the thing that keeps us young and radiant and vibrant. So if we can eliminate that, we will in fact look younger, age slower, and more vibrant. So many surgeries happen every year. For obesity, it's liposuction. We get facelifts, right? Because we are, unfortunately, succumbing to gravity and less collagen. People get breast implants, etc. My theory is, the better you feel with a better diet, the higher your self-esteem, the less of these surgeries you're going to need. And we're on to one. The number 1, which I think is really, really cool. It's the most exciting thing out of everything, I think. It's something called epigenetics. Anybody heard of epigenetics? Yeah, so it's so cool. We used to think that DNA was like our destiny, right? We used to think that the genes we have are what we're going to be for the rest of our lives. I have a gene that puts me at risk of getting Alzheimer's. Well, we're finding out through epigenetics That gene may never need to be expressed. We don't have to turn that gene on. So epigenetics is the thing that determines whether a gene is going to be expressed or not. And what's cool is it goes on to a progeny. We know that the changes and the decisions that we make now go to our offspring and then our grandchildren. We've seen that, which is very interesting. So just to look at a picture, the epigenetics, we have all these things that influence our DNA and whether our DNA gets transcribed. So we have things like our environment, our development, drugs, whether we're exposed to any environmental pollutants, all that can determine whether our genes get expressed or not. And like I said, it's transgenerational. It doesn't just stick with us, it goes to our offspring. This is a very cool study done in Överkalix, Sweden. Unfortunately, there was a famine in the early 1900s. These people spent one season really struggling for food. And what we found, them and their offspring had a lower risk of heart disease from one season. It's interesting. We don't really know why. We don't know all the mechanisms of it, but it's very, very interesting and very exciting. This is the forefront of nutritional research right now. This is what we're finding out. What compounds, what foods can turn genes on and turn them off. So we have our 10 ways. Quick overview, very brief, talking about how we can reduce the 10 killers. Let's put it all together for a second. So it all starts with an unhealthy diet, sedentary lifestyle, not moving around, high stress, medications, and then we get problems, right? We get cell injury, inflammation, and it leads to obesity and chronic disease. Well, how about we stamp out that unhealthy lifestyle? And then we can go on and stamp out everything else, and ultimately eliminate all these diseases we're talking about. So this question gets asked a lot, debated a lot. Can we say what diet is best for health? I'm convinced it's a whole food plant-based diet. But a paleo person may not be so convinced, right? Or Atkins, who knows? But I will tell you this. If you're in a lunchroom, wherever you work, and there's a paleo and a vegan and they come in for lunch, and you look at what they're eating, they're almost the same, minus the meat that the paleo person is eating. But they're eating whole food as far as fruits, vegetables, etc. We know that. And that, to me, is an improvement from the standard American diet. Does that make sense? It is an improvement. So what do all these diets have in common? We have the low carb group, we have low glycemic index, we have the Mediterranean, we have the mixed people, we have the paleo people. They all involve plants. So there's that saying by Michael Pollan, which I just love, and it's eat food, not too much, and mostly plants. And honestly, that is what these diets are doing. I kind of like this pictorial, just to review it real quick, but it's food calories per pound. So we can talk about caloric density, we can talk about inflammatory foods. We know the fruits and the vegetables are low inflammatory foods, and they have a low caloric density. You can eat a whole bunch of them, and you don't get that many calories. But when you look at the oils, when you look at all the processed food, when you look at meat, you can eat just a tiny little bit, and you're going to have already all the calories that you require for that day. The problem is we don't stop eating when we meet our caloric requirements. So back to the quadrants of health we talked about before, super important. So healthy eating, physical activity, healthy weight, and emotional resilience. I live my whole life this way. What does that buy us? Well, not what lifestyles can do, what you can do, right? What can you do to improve your life? Well, you can decrease heart disease by 80%, decrease diabetes by 90%, you can reduce your cancer rates by at least 60%, some people say more. So it leads us to believe that your DNA is not your destiny, your lifestyle is. It's all about lifestyle. And then I'm going to end with this one quote I just love. Thomas Edison, "The doctor of the future will give no medicine but interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease." That guy was way ahead of his time. So anyway, thank you guys so much for your attention. Thank you.
Well, that was an awesome presentation, and I feel honored to be here and watch it live. And I hope you guys share that with your friends. Please remember to put comments below. Click here to subscribe. And remember, be strong, be well, and be